You said it's a state of moving from fertility to infertility, and I guess a whole lot could happen during this period. Let's talk about them.
The first thing I would like to say is that the gradual change from a state of fertility to infertility, which we call menopause, is gradual. It is not sudden. The stage that is observed, which consists of several years, is called the perimenopausal period. And most of the signs and symptoms of menopause begin, or some of them are even worse, in the perimenopausal period. And the first thing that a lot of people experience is the irregular menses. Of course, menses becomes irregular because the estrogen that is responsible for regular period, which is the hallmark of ovarian function, is becoming irregular in the system. So the system becomes irregular, and that is the first thing. Then you now begin to see a gradual depreciation in the person that is undergoing menopause. The hair becomes brittle, they get more tired, they have some little psychological sequelae. They become moody, become irritable. Some of them have difficulty in concentration. Some of them become forgetful. They have abnormalities of memory. Then, of course, the physical changes. The skin becomes more brittle. You know, when they have injuries, it takes a long time to heal. The breast becomes flat. You know, and those rounded figures that make somebody more feminine, you know, it starts becoming angular because of the absence of the estrogen. They have an increased tendency because they have what is called osteoporosis, which makes the bone, a condition that makes the bone more brittle, weaker than it normally is. And they are prone to what is called pathological fractures. That is the breaking down of their bone without any obvious cause, you know. Then the other issue you will see is the issue of dryness of the vagina, atrophy of their female organs. Some of them will now begin to have pain when they attempt to have intercourse, a condition we call dyspareunia, the tendency to have infections, you know. And in people who already have a pre-existing medical condition like hypertension and other cardiovascular diseases, the onset of menopause tend to worsen. The other one is people that are obese, people who have problems with weight. It gets worse because now they have stopped menstruating. So at least the blood they are losing every month has stopped. So there is this common problem of weight gain that comes with menopause.
What about the issue of hot flashes and night sweats?
All these things we are seeing is actually seen in less than 50% of people who are undergoing normal menopause. Some people, their premenopausal and menopausal period are uneventful, but it is good to know that in some people, this, including the hot flushes, which are actually vasomotor changes, and night sweats, are issues that will herald the onset of menopause. And it is good to mention it because when they get to hospital and they complain, it might be misconstrued to be the presence of another medical disease going on. Yes, hot flushes and night sweats, very common. All these factors that we have highlighted and a very high level of suspicion from the medical personnel will make a fairly decent diagnosis of the onset of menopause, or probably the onset of pre-menopausal symptoms. We don't usually say go and do some blood tests to find out whether you are in menopause.
What is the option?
In people whose ages are not in the bracket of menopause,
okay, those who
and they are complaining, yes, you can now do hormonal studies, which will obviously show you that the ovarian hormones will be low, then the anterior pituitary hormones will sense that and will try to push the hormones to work. So those anterior pituitary hormones will be very high while the ovarian hormones will be low. That in those group of patients actually tells that they are in the menopausal period.
When would it get to a point where some of these symptoms that you've mentioned would need medical attention?
When the severity of all we have highlighted begins to affect the everyday life of a woman, it begins to affect their sense of well-being. Then they will come to hospital not knowing that some of these things are actually menopausal symptoms. So it is good for the medical personnel to be able to properly aggregate this with his experience. And the reason why I'm saying this is that all that might be necessary is to reassure and properly educate the complainant that what you are feeling is not as a result of any disease process going on. You are just growing up normally, and these are some of the things that shows that as from this point onwards, you are moving away from the group of people that will be able to get pregnant and bear children. That is, your fertility stage is rounding up. And that, in most cases, is enough to resolve the attendant anxieties and things like that. The treatment options are actually tailored to the complaints, because the complaints and the severity of these complaints has individual differences. For example, what is common is that some of these menopausal women complain that it becomes almost impossible for them to have intercourse because of the dryness of the vagina and things like that. And when they attempt it, it causes pain. You cannot intervene in that area because of the attendant social difficulties that might come from it. So some of them are so severe in severity that you are actually pushed to go and give hormonal supplements to tide them over. Because what we find out is that this period we call premenopausal period, the symptoms are actually worse. When the full menopause starts, that is, they have stopped seeing their period for more than a year, some of these hot flushes, some of these complaints regresses as they settle into their menopausal period. So for that time, you might need to give hormonal supplements either by mouth or by application. Some of them complain frequently about skin problems. Some of them complain of, they call it formication, a feeling of crawling of the skin. And when you look at the skin, it's rougher than usual. You need to relieve some of those symptoms by applying estrogen creams. You know, the other issue to quickly talk about is the ones that complain of psychological problems, the inability to sleep, the forgetfulness. We also, at some particular point in time, are forced to give hormone replacement therapy to tide them over those periods. So you actually give treatment or you intervene depending, you tailor it to the particular needs of the person in menopause.
As we wind down, you said smoking, alcohol can predispose a woman to early menopause. What are the other things that women could avoid and some that they should embrace to make sure that all of these things happen at the right time naturally?
Yes. Another thing that we find out is that some of these symptoms are relieved by lifestyle changes like regular exercises, wholesome diets, and things like that. The other thing to quickly mention about this menopause is to use this opportunity to debunk a lot of taboo. One is that it is not a taboo and it will not result in any disease if a man has intercourse with a woman that has stopped menstruating. What we find on the field is that men who have problems urinating as a result of obstruction of their urine flow, either from an enlarged prostate, or they blame their partners who are not menstruating. There is no truth in that. There is no truth. There is no danger in having intercourse with somebody who has stopped menstruating. I've seen couples, I've seen men who have married younger wives just because their original partners went into menopause, and they are now saying that the reason they married a younger wife is because they are not supposed to have intercourse with somebody who is not menstruating. So it is good to mention this. Everybody grows old. From somebody who menstruates every month to somebody who doesn't menstruate again. It is part of growing up. If it comes to some little complaints, it is good to understand that it is still part of growing up. If it is unbearable, seek medical attention. There should not be any secrets about complaining about some of these things. And maybe I should look at it from on the other side.